Friends, I am Dr. Surjit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Tissue salt therapy, part 12, Calcarea Phos.2. If you are new to TST, viewing parts 1 to 6 is a must. This is a very important point to remember. Basically, these are learners actually video. So if you want to learn this tissue therapy seriously, you must view part 1 to 6. If you are new, if you already know something about this, then you can omit that, because in those videos the selection of medicine, its potency, its dose, its repetition, these are very technical things have been elaborated widely. Face symptoms of Calcarea Phos: pale, anemic look, skin unclean, pain in face as if worms or ants are moving about, face cold, insensible, rheumatic or neuralgic pain as if crushing or tearing, Mac Phos. That is, in Mac Phos also this symptom is there. Facial skin sweaty, hot, acnes of teenagers, especially faces of girls full of red eruptions and impetigo. Now, this is testing for anemia. This is red eruption on face, and this is actually a very important thing, because this is prior to treatment with Calcarea Phos. This is after treatment of Calcarea Phos. Mouth symptoms of Calcarea Phos: foul smell in mouth and halitosis due to incomplete digestion of food. It is also there in natrum phos. All problems of babies during dentition, gums red, painful, teeth decay as soon as erupt, Calcarea fluor. Also this symptom is there. Toothache, especially at night, silicea is there. Upper lip swollen, painful. Tongue symptom Calcarea Phos: tongue swollen up, hard, numb, pimple on it, blister on the tip. Just look at the images related to this discussion. Mind it, halitosis actually means bad breath. Third symptom Calcarea Phos: goiter, chief remedy. Goiter, you know, this is a very this is actually disease of thyroid gland. You know, when thyroid gland, secretion of thyroid glands is disturbed, then goiter actually appears. It is over secretion of T4 hormone. Chronic tonsillitis. Now this chronic now the what I'm saying, that goiter is a very important systemic disease, and we have got beautiful medicine in Calcarea Phos of goiter. Chronic tonsillitis, chief remedy: pain in glands, pricking pain during deglutition of food, drinks, more pain on empty swallowing, mouth, tongue dry, hoarseness of long duration, tendency to clear throat by cough and hawking, mucus tenacious, friend of public speaker. That is, public speaker often feel hoarseness due to overuse of throat. So in there, Calcarea Phos is a good friend of those type of persons. Third symptoms of Calcarea Phos: burning in pharynx and larynx, chronic infection, constantly mucus passes from posterior nares downwards. Stomach symptoms of Calcarea Phos: pain felt in stomach after food, as if food is solidified, burning and heaviness, pain from little food. It is also there in Ferrum Phos. Crave salted grilled meat, vomiting of cold foods, drinks. Infants want to nurse all the time, vomits often, heartburn, flatulence, headache, diarrhea, worse, eating. Now the images. This is pharynx. If you just throw a torch light in the throat, over the tongue, this is the portion you see. This is called oropharynx actually. Oropharynx or pharynx, part of the pharynx. This is larynx. You cannot see this in open eyes, normal eye, because it is a laryngoscopic view. It's an instrumental view of larynx, the voice box. This is gastroesophageal reflux or heartburn. I have written it's heartburn. Heartburn actually GERD. In modern science it is called GERD, gastroesophageal reflux disease. What happens here? The stomach has got two sphincter, that is two valve-like structure, one in the esophagus end, another in the duodenal end. This is called pyloric sphincter, this is cardiac sphincter, or LES, lower esophageal sphincter. Normally this sphincter should remain closed when food passes through the stomach. The stomach accumulates the food first, taken up food, and then it is mixed up with water and some acids from the wall, HCl acid, low percentage HCl acid comes out, and this remains in the stomach for some time. Then it is gradually passed through pyloric sphincter into the small intestine. But due to disease condition, sometimes what happens, this sphincter should remain closed. It opens up, and yet it is not ready to go through pyloric sphincter. So what happens, it regurgitates in the esophagus and goes above in the throat region. There this heartburn appears. This is called heartburn. Flatulence means actually accumulation of gases in the stomach. Naturally, when we eat food, a lot of gas we also swallow. So here air is there, air, water, acid, food, drinks, everything is there. But this sphincter should remain closed while it is resting in the stomach. Thereafter gradually it will pass through pyloric sphincter. But this doesn't happen in GERD diseases. Doesn't happen. Stomach symptoms of Calcarea Phos. Epigastrium sore, cannot be touched. Better feeling from hot drinks, foods, temporary relief from belching. Note down, this is the right epigastrium. This is the picture of epigastrium. Epigastrium is the upper portion of the abdomen. Abdomen has been divided in 9 portions in medicine. The middle top position is called epigastrium region, just beneath the sternum bone. On the right hand side it is right hypochondriac region, left hypochondriac region, central it is umbilical region, right lumbar region, left lumbar region, at lower end hypogastric region, right iliac, left iliac region. These 9 quadrants of the abdomen have been very often referred to while discussing about medicines of abdomen. Infants vomit out sour curdled milk after nursing. This is the picture. Stomach bloated, mesenteric gland enlarged, palpable easily. This is palpation of a baby's abdomen. In an expert hand, the mesenteric glands are easily palpated. Mesenteric gland, enlargement of mesenteric gland. Mesenteric gland actually, lymph glands lying in the mesentery. Mesentery is nothing but which holds the intestine. The whole intestine is held up by particular thick structure called mesentery, and there are lymph glands, enlarged lymph gland. Actually, those are very often infected with tuberculosis. So, Calcarea Phos is a very, very good medicine for this type of patient. They will never be infected with tuberculosis if this is given properly in time. Headache, belching from indigestion. Famous Dr. Carey remarked, all gastric symptoms of Calcarea Phos are due to indigestions. Life case. Minu Boericke of 12 came to my chamber with her mother. Very shy, pale face, head always down. Mother reported her memory was very weak, no attention to studies. Having returned from school, sit idle, supporting her head with her arms. When asked, used to say, much pain was there in head. Her menstruation started 4 months ago. Severe pain troubled her every month. Very scanty discharge, but white discharge ran throughout the month. Her lower inner garment bore the sign of it. This is the actually reported by his mother, by her mother. She was given, Minu was given calcium phos 3x 2 grains thrice a day for 10 days. Actually, for not 10 days, for 2 weeks. Mother was requested to report after 2 weeks. There is for 2 weeks given and 2 weeks reporting. After 10 days, mother reported, Minu is doing very well. There is no pain in head, neither any white discharge, but menses do not appear in this month, though date crossed. I will report in details in person going to chamber. These are the words as communicated by Minu's mother. So I am sure that she is almost 60% cured. Rest will be taken up by the same medicine, may be required in slightly higher 6x or 12x potency. But it will be completely covered by this medicine because this is a very young child and calcium phos is their greatest friend.